How to test your child for COVID-19 with the Rapid Response Antigen Rapid Test. Watch this step-by-step video to make sure you do it correctly. Step 1. Get ready. Before collecting your sample, take the collection tube and put it somewhere it can stand upright. You can use something like a coffee cup, tissue box, or even Play-Doh. Empty the entire contents of 1 capsule of testing solution into the collection tube. Step 2. The nasal swab. Remove the swab from its packaging. Ask the child to tilt their head back. Next, insert the swab, just 2 centimeters into the nostril. Swab the inside of the nostril 5 times using a circular motion. Pinch the nose closed with your fingertips to trap the swab and rotate the tip 5 times. Remove and use the same swab to repeat the process in the other nostril. 5 times around, 5 times rotating. Step 3. The test procedure. Remove the collection tube from your stand and stir the swab in the solution 10 times until it is mixed well. Squeeze the swab in the solution 10 to 15 times by squeezing the walls of the tube against the swab. Leave the swab inside the collection tube and place it into the stand for 2 minutes. Use a timer to make sure it sits for 2 full minutes. After the 2 minutes are up, remove the swab from the collection tube while holding the walls of the tube so you can squeeze as much liquid as possible from the swab. You can throw the used swab into the waste. Put the small nozzle cap on top of the tube to seal the sample and set back in the stand. Open the pouch labeled cassette and place the testing cassette on a flat surface. Turn the sealed collection tube upside down and squeeze 3 drops of the liquid into the sample well of the testing device. Set a timer for 15 minutes. After about 15 minutes, colored lines will appear and you are ready to read the results. Step 4. Read the results. This is what it looks like. If the test is negative, continue to monitor for symptoms and then repeat the test in 48 hours. It needs to be done twice to ensure the best accuracy. If the test shows invalid, you can try another rapid test or visit a provincial testing clinic for